Learn how to properly manage your shoulder pain with Dr. Andrew Trueblood.
Shoulder pain is one of the 10 most common reasons why people see a doctor for anything. The small muscles in your body get weak quicker than the big muscles do. Typically, my threshold for thinking that it's a good time to go to see the doctor, if I'm having trouble with my arm, the times when I start getting nervous about it not being okay is if it's waking me from sleep, or if it's keeping me from doing things that I really need to be doing. When you come to see me, basically we take a full medical history. How did this happen? When did it start? Do you remember doing anything in particular that led up to the problem? Sometimes there'll be an x-ray, often especially for older people that's the case, and then a complete physical exam. Typically, a patient can see me within a week to 2 weeks at the latest. The main constraint tends to be having our schedules aligned because I try to be in office every day. If we catch things earlier, the solutions tend to be easier. Or if they're not, at least there's no guilty knowledge involved. Frankly, by the time you're done, I'd like to see if I can get you some relief.